Now, there's another part of this. There's something called Mass Pro, and they're supposed to deal with complaints about this use of government money, whether you got credit, whether the people who took the money did the things they should have done in the proper fashion and so on. And I went there, and I thought it was a whitewash job, really, because the doctors could do no wrong, diagnoses didn't matter. They didn't take up the question of a doctor that, like the one at Epic House, maybe being overloaded and having too many patients to give them proper care, and so on. But they did point out to me that a form I signed on the day we left Sherrill House was the wrong form. If they'd given me the right form, and they should have given it to me 2 or 3 days before we left, but the very morning we left, they gave me this form, and that form, if they'd given me the right form, that form says that if I protested, she would have had an extra 5 days there while they took up the case. Incidentally, in those 5 days, she was back in Newton Wellesley Hospital with all the problems. If she'd had those things occur while she was at Sherrill House, they would have been taken care of, and her good mood and sense of optimism would have continued. But they gave me the wrong form. They gave me a form which was, in a sense, illegal. So, in a sense, this is another denial of proper procedures and an act of misfeasance, malfeasance, negligence, whatever. But anyway, then I went to the Board of Registration of Medicine and tried to detail these matters, and since there were 3 doctors involved, I made my complaint. The doctors answered, except that one was given an extended period of time to make his reply, and I was waiting for the 3 reports to come in, because actually there was a continuum here. Things are moved from doctor to doctor with written suggestions and comments about treatment and so on. And so I wanted the whole case before me. And what they did was they heard 2 of the cases before I sent them my comments on the doctor's comments. And one of the doctors, the one at Sherrill House, he said, well, it was all right to send her home with mercy, even though I had complained that maybe with grandchildren, etc., that was a bad thing to do, and I hadn't caught it. Well, I've got the prescription bottle at home because I did catch it. And I took medicine for it that was given to me by Harvard Pilgrim after this was all over, because I had acquired MRSA from her. So the doctor made this statement without any knowledge, and I think that was typical. I thought his answers were ridiculous and perhaps even insulting, mind you. But anyway, I gather he has now retired, and I rather hope that I was a part of convincing him that that was the thing to do. But anyway, and the board that investigates nursing homes, I think, does a very poor job. The inspection is relatively useless, etc., and so on. But anyway, the Board of Registration of Medicine heard 2 of the cases without my response, and I asked them to reopen the case and consider my response, and they said they wouldn't do this. I think this was a denial of due process. But finally, the 3rd doctor, I did answer his complaint. When I say the 3rd doctor, I meant that is the one who was the first one, who was our GP at Harvard Pilgrim. He was the one who had an extended period of time to answer the complaint. Now, they told me at the Board of Registration that they had told me that I had to reply in 30 days. They did not tell me that, or I didn't hear it. My hearing is bad. But it just should all be in writing. This is a terrible way to proceed. You should have instructions in written form as to what's going to happen and when it's going to happen, and to be informed of all the proceeds as they proceed. But anyway, that really the end of this, except to comment that we really don't have a system. We have a melange, a cafeteria. People go from one doctor to another without adequate communication or knowledge, and maybe even responsibility. I think she was abandoned by her general practitioner, and she got the wrong form, which should be illegal, as if we had been able to keep her at Sherrill House for another 2 or 3 weeks, I expect she would be alive today. She would never have been as healthy as she had been originally because of the long delay in the diagnosis, which had caused, I expect, permanent damage to her heart. But that's the end of the story, I guess. I've been asked to talk a little bit about some of the economics of this, because after all, I'm an economist. I was the graduate dean at Babson College, and I've worked with the Central Bank of Jordan and written 2 reports for the U.S. government and so on. So I think I got a little competence in the field. But anyway, right now I think we should have a solution to a couple of problems, or at least partial solutions to the problem. We have a great economic crisis, and we've got this medical crisis, really. And what we should do is say to all the employers in America, you no longer have to pay health insurance. The government's going to take this over. And since we're reducing your cost, we hope you can export more and maybe reduce prices, hire more people, and help the economy recover somewhat. And you're not going to have all the extra cost and paperwork and bargaining about health care and bargaining with insurance companies and all that tremendous drain upon your efforts and time and money. So that's part of it. The other thing is, as far as the workers are concerned, they'll still get the same take-home pay, and they will, however, have to face up, as everybody in the country will, to a national sales tax which is dedicated to paying for health care. And this can be adjusted up and down as needs go. There will be no problems like there is with the Social Security Fund of keeping the fund balanced and things of that sort. This will be kind of a pay-as-you-go system. This is the way, incidentally, we financed World War II, was on a pay-as-you-go system. So this is not a radical new idea by any means. It's a time-tested idea. But anyway, now, if people don't want to be in a government plan, which has a single payer, of course, for all kinds of reasons of efficiency and cost comparisons, et cetera, they can stay with their present insurer, continue to make their payments to the private insurance companies, who contribute really nothing in the way of actual care for the health problem of the country. They contribute bookkeeping and sometimes the denial of benefits and so on. But anyway, they can stay with their insurance companies if they wish, and they can keep track of their sales tax cost, and they can submit this with their income tax at the end of the year and be reimbursed for it at that point. So we're not denying anybody anything. We're opening up an opportunity for everybody. And under these circumstances, the government will be able to bargain for the price of drugs, and that'll be a tremendous difference in cost across the system, and so on. Record keeping will be uniform. Information flows will be better. This will be a much better system. So our present, I hate to say system, let's say melange of services, assortment cafeteria of services, is very inefficient, and it's time we got rid of it, like most of the intelligent, well-balanced democratic countries of the world.